The pandemic has certainly caused a lot of changes, and many for the worse. But the rush to get back to how things were, to get back to the status quo, could also be a mistake, particularly in terms of mental health. Because I don't think how things were was fantastic. If we take the improving access to psychological therapy services as an example, they would have between 1.7 1.8 million referrals a year. About 24% of those people will be cured of anxiety and depression. I don't call that fantastic. If we think of long-term antidepressant use, and I like to use the image of Wembley Stadium holds 90,000 people. About 15,000 of those will be on an antidepressant. That's not fantastic. Prescriptions for antidepressants and anxiolytics are over 70 million, and that's doubled in 10 years. That's not fantastic. When did it become acceptable to use a mind-altering, brain-changing drug in preference to doing something simple, useful, and clinically effective to help yourself? So how can we do things differently? I think that we can encourage people to look at mental health problems as problems to be solved. People solve problems all the time, and they're very good at it. And if they can't solve a problem, it's because they don't know what the problem actually is, because they don't know how to solve it, or they lack the resources to solve it. But whereas a narrative in society in general that you can actually do something useful and clinically effective to help yourself, at best it's an add-on, but generally you just don't see it. People take a journey to severe distress and breakdown. But suppose whilst they're on that journey someone said, hang on a minute, you don't need to be depressed or anxious. These terrible experiences that you're having are the result of unhelpful thought processes and programs that you're running that you're unaware of. They're the result of unhelpful behaviours that you're doing. They're the result of emotional programs that you're running that are not calibrated to external reality. They're the result of sensations that you experience, you focus your attention on, you catastrophize, magnify, and make the problem worse. Here is an online program that you can use on any device. It will teach you to change your unhelpful thought processes. It will help you to do more useful behaviours. It will help you to manage your emotions better, and it will stop you catastrophizing about sensations. How many journeys to distress and breakdown might that prevent? How many people might that empower? Now, within parameters and limitations, nobody needs to be depressed or anxious. Even with a significant genetic loading, it is not inevitable that these processes will occur. And if anxiety and depression can be cured by therapy, which they can, then their chronic persistence suggests that there's a lack in society of the things that therapy, the benefits that therapy gives. The knowledge, the skills, the tools, the productive relationship to the problem, and an understanding of how to solve the problem. If these things were readily available, I just don't see a downside. And if you couple that with a narrative of self-help is really useful, it's clinically effective, it will help you to change your life for the better, I just don't see what the problem with that is. One consequence of the pandemic that I'd like to see is that people realise they don't have to outsource their mental health. They can look after it themselves, because actually it's more important to them than anyone else. They can take back control of their mental health. If you want to know more about self-help CBT, please visit drpurvis.online.